The next video in our series covering the impacts of climate change that are relevant to health professionals is going to focus on the impact of climate change on health systems. So our learning objectives here are to describe the impacts of climate change on the healthcare system, including infrastructure, supply chains, and care delivery systems, and to give you some examples of current vulnerabilities and projected future needs for our preparedness. So this CDC diagram here highlights the ultimate kind of radiating impacts of various climate drivers. In the center there you see rising temperatures, more extreme weather, sea level rise, and increasing CO2 levels in our atmosphere. And as those effects radiate out, we see kind of the ultimate consequences to human health. But of course, then as a healthcare system, when we are tasked with responding to those consequences, there will be impacts for the systems as well. So for instance, in the case of increasing burdens of chronic disease, asthma, cardiovascular disease due to chronic exposure to air pollution, we're going to see an increased healthcare burden for both acute and chronic illness. So for instance, we might see an uptick in ER visits for asthma exacerbations, or for cardiac issues, but we might also just see kind of a gradual increase in the demand for our management of chronic conditions. The other thing I want to call attention to in this context is the idea that we're all generally aware of in healthcare, and that is the projections in our changing demographics within the US population. And so we have an aging population, and that distribution is projected to change in the coming years, with up to 25% of our population over the age of 65 by the year 2020. And so with this aging population, we have an increasing burden of chronic disease, and we're already talking about shortfalls in our healthcare system and our ability to care for these individuals. So with pre-existing shortfalls in mental health care and primary care, without even the consideration of the projected impacts of climate change on the health of these populations, this can potentially be something that could be a greater shortfall than we've initially anticipated. As we're thinking about the burden on our healthcare systems, we also need to remember that these things aren't happening in a vacuum. So this slide here shows an interesting recent study looking at the impact of 2020 wildfires, wildfire smoke, and the risk of COVID-19. And so these maps here of Washington, Oregon, and California show the various regions and how the impact of wildfire smoke, with red being a higher impact area. And even after adjusting for various different confounding factors, they found that there was strong evidence that wildfires amplified the effects of short-term exposure to particulate matter, which then changed the ultimate risk and increased risk of COVID-19 infection and death in the counties that were most impacted by wildfire smoke. So in a changing climate, in a changing dynamic system, it's not just going to be, a linear process of increasing demand. There will be multiple complex factors at play. The other thing that we can anticipate with extreme heat and, again, an increased demand in healthcare services will be increased ED visits and hospitalizations. And we've seen this in 2021 all over the news and in our health systems. So this slide here is a graph of the emergency department visits for heat-related illness comparing summer of 2021 with summer of 2019. So in summer 2021, we see here in this week of June, in Region 10, the Pacific Northwest, a giant spike in emergency department visits for heat-related illness. And if you look, that spike there is in the solid black. If you look at the blue dotted line at the very, very bottom, that is the 2019 rate of visits for emergency department visits. So you can see a massive uptick in demand for healthcare services there that somewhat overwhelmed emergency departments in the region. If you're more of a visual person looking at a map, that region 10 there in the Pacific Northwest, during that week here, this map shows the rate of emergency department visits associated with heat-related illness per 100,000 ED visits. And if you want concrete numbers for comparison, just on one day, June 28th, temperatures in Portland were 116 degrees within the metro area. And within that region, they saw over 1,000 heat-related emergency department visits. And if we want to compare those absolute numbers in 2019, that same day in 2019 only had 9 emergency department visits for heat-related illness across the entire region. So a significant demand, a significant burden that we weren't necessarily prepared for, and is only going to be increased as we see an increasing frequency of these extreme heat events. Another important consideration will be the impacts of severe weather on our supply chains and our healthcare infrastructure, which is likely also going to coincide, or frequently does coincide, with an uptick in demand for healthcare services as we see natural disasters causing injuries, fatalities, mental health impacts as a result of the trauma of going through these events. This table here outlines the impacts of Hurricane Sandy on healthcare systems in New York and New Jersey. And you can see they look at the various providers of healthcare, whether it's hospital, nursing homes, community-based providers, or home-based providers. There were impacts across the board of whether the equipment, the buildings were flooded, if utilities and power failed and there was no backup, or the backup that was available failed. Phone and internet outages being a significant impact, and transportation, getting staff to the hospital to help address the surge in demand. These were all significant issues that impacted our ability in that instance to care for patients. The maps on the left here are showing the locations of hospitals in Charleston, South Carolina, and Miami-Dade County in Florida, with an overlay of the projected storm surge areas for different categories of hurricanes making landfall at high tide. And so you can see that the different categories are going to cause different degrees of flooding, but those dots in red are hospitals that are right in the path of flooding from these hurricanes. And so these hospitals are going to be more exposed to these risks, are going to potentially be flooded, and this is going to coincide potentially with an increase in demand for healthcare services in these emergencies. So things to consider as we're thinking about these projections for climate change, increasing frequency of storms, rising sea levels, etc. We can also think about wildfires and how these might impact healthcare infrastructure. So an extreme wildfire risk and or during wildfires in California, they've shut down power, and that has potentially impacted infrastructure within hospitals, clinics, pharmacies, etc. And in the 2018 Camp Fire, there was actually destruction of a hospital, emergency vehicles, and ultimately a need to evacuate all patients from a hospital as a result of this totally out of control wildfire. So when we're talking about extreme weather, hurricanes, sea level rise, we are to some degree insulated from that in Montana. These aren't necessarily issues that are going to impact us directly. But as we have certainly learned through the COVID-19 pandemic and through other events, this is a global world. We're connected across through our supply chains, and we do need to consider what is happening on the other side of the world. So this map here shows the countries that have been most affected by extreme weather over the past several decades, and I'll call attention to Southeast Asia, India there, as well as the number one on the list in the lower left, Puerto Rico. So these regions that have been most affected by extreme weather are important to us. The reason that these extreme weather events and disasters are important to us is not just the impact on the people in those regions, but also the impact on our generic drug supply chain. So China and India, for example, are responsible for over 80% of the manufacture of our generic drug supply. And if you look at the map on the right-hand side here, you see the vulnerability of various regions in India to different natural disasters. And you can see the striped blue are the cyclone-prone areas, they're flood-prone areas, and areas that are vulnerable to both drought and sea level rise. And on the left-hand side here is a map of various kind of critical pharmaceutical clusters for research and development, bulk drug manufacture, and formulation of the different products that come to us in the United States. And if we do an overlay, take those dots and put them on the map of the vulnerability map here, we see that a lot of these are located right in these cyclone-prone areas, in areas that are vulnerable to floods or sea level rise. And so this is a really important consideration for our generic drug supply chain, and as we plan for any type of resilience in our supply chain. Other important considerations here are the changing demographics by those that are going to be served by our health system. So we're potentially going to see an influx of refugees as a result of forced migration, civil conflict, as the environment becomes degraded to the point that people are no longer able to survive in areas where they used to be available, as crops fail due to issues with drought, food supplies then become an issue, malnutrition, etc. We're potentially going to see an influx of refugees into the United States and into the areas that we are serving. These populations may have different health challenges. There may be language barriers, cultural issues that we're going to need to consider, and we're also just going to need to consider that this is going to result in an overall increased demand for healthcare services as we see an influx of people into the areas that we're serving. As we see changing patterns of infectious disease, whether due to vector-borne illness or to waterborne or foodborne illness, we are also going to have challenges that we'll need to meet in vaccine development, in development of new medications. And we're also going to see a greater burden of infectious disease that may coincide with our other human-driven and potentially existential threat of antimicrobial resistance. So we potentially have increased waterborne illness that may also, as a result of antibiotics in the environment, have more antibiotic-resistant bacteria. The map on the left here shows changing distributions of mosquito habitat based on different climate projections here. So if we continue on with business as usual, we'll see changing distribution of two mosquito populations that are responsible for carrying various disease, including dengue. And you can see that those habitats are going to shift into regions that have not typically had to deal with these threats. And that's going to put demand on us to develop vaccines, develop new treatments for these new and broadened populations. And as we've learned, this is not an easy thing to do necessarily. Our current vaccine development, research and development system is slow, resource intensive, difficult as we're thinking about distribution, etc. So I'll talk a little bit more about that in our adaptation section, but this is going to be an important impact. We also need to think about the overall healthcare related costs of climate change. So a recent report that came out from NRDC in collaboration with the Medical Society Consortium on Climate and Health found that there were billions of dollars of healthcare costs due to climate-sensitive healthcare impacts over the past 10 years. So various studies, whether it was Michigan looking at Lyme disease, at the impact being approximately $8 million, everything from Hurricane Sandy at $3.1 billion, wildfires in Washington and Colorado, at $3.9 billion, you can see that this is a very, very expensive thing. So when we think about the costs of potentially addressing climate change, the costs not only to infrastructure and recovery of these various impacts are going to be significant, but there are also going to be significant costs as a result of increasing demand for health services. With those increasing costs, we are also just thinking about what's happening with the healthcare system. So costs are typically going to run in line directly proportional with the resources that are being used, including our emissions from the healthcare system, pollution, waste, etc. So as we see worse health outcomes, we're also going to see a greater climate impact from the healthcare system. And this will be something that's covered later on in the series, but with worsened human health, we're going to see potentially degradation of the environment to a greater level, increasing drivers of climate change, which then is going to result in negative human health impacts, increased healthcare burden, and this is going to ultimately result in this feedback loop that can become this really, really disastrous thing. However, this feedback loop could potentially run in the other direction if we think about addressing climate change and improving human health overall. If we can improve health, we can decrease emissions, decrease pollution, waste, decrease cost, decrease the impact on the environment, and thus ultimately improve human health. So as we're thinking about this overall, we're thinking about environmental care and health care being two things that really need to go hand in hand. So after all of this doom and gloom in this presentation, I apologize. I do want to give you some hope. Later in this series, we will go through some solutions-oriented things that we can do, actions we can take to adapt, to change, and to ultimately improve our resilience to these potential impacts on our health systems. So thank you so much. We'll see you in the next video.